to thank everybody for coming out tonight with the weather as bad as it is. I would apologise to Professor Malloy because I'm afraid I've been a bit cute here because I've actually cut my speech up into 3 parts. I'm going to talk for about 10 or 15 minutes just about expedition medicine and what it actually means and why we actually get involved in going on crazy expeditions. I'll talk about Kilimanjaro Achievers and how it was formed and why it was formed. And then a colleague of mine, Manuel Hennessy, who was great help this year, will talk about specifically about Kilimanjaro Achievers. And then we want to introduce one of our star climbers who recently received a civic award from Kildare County Council. Shane has cystic fibrosis and summited with us last October. But it's a little bit more than that, so we'll talk about Shane as we develop our talk. What is remote medicine, expedition medicine? Well, it concerns maintaining the physical and psychological health of all climbers, all people on expeditions during the stresses that is involved in the expedition. The aim of it is to minimize trauma and disease through proper planning, preventative measures, sensible measures, having the right skills, and by skills we mean skills for outside of hospital. So hospital doctors therefore need to train in pre-hospital skills, and most the experts in this area are the paramedics. In the United States, expedition medicine is called wilderness medicine. And the definition of wilderness is a tract of solitude and savageness. So about 200 or 300 years ago, expeditions were regarded and expected to be dangerous. This map is a map of Africa. And back in 1874, a gentleman called Henry Morton Stanley, in tracing the course of the sorry about this. Would you believe I did? Yeah. In tracing the course of the Congo, he set out in 1874 from a little island of Zanzibar with 224 members in his expedition party. By the time he crossed Lake Tanganyika, found the source of the Congo, and then traced all of that to the where it opens into the Atlantic Ocean, and declaring the whole of the Congo for King Leopold of Belgium, the number in his party was down to 114. They died from dysentery, smallpox, murders, cannibalism, slaves, you name it. At the time, Stanley was criticized for pushing his men a bit too hard. Since then, expeditions in the 20th century were more about geographical and scientific discovery. So in 1953, the first assault on Everest, one of the physiological important events that took place at that time was that the climbers used oxygen and used oxygen on a scientific basis, which had been discovered by Professor Pugh from Imperial College. And he'd spent the previous 10 years trying to detect the correct flow rate of oxygen so that climbers would not have to carry too much oxygen up the mountain, but they would get the benefit from the correct flow. But of course, he got no credit for that. 21st century expeditions now are either for pleasure, professional development, or cultural exchange. But the priority now is to minimize the risk for all people going out on expeditions. And of course, currently a big opportunity for people before they go to college is the transition gap year, and more people in this year seem to be availing of those opportunities. Expeditions can occur, depends on where the expedition goes, but it really does depend on climate and the seasons. There has been in the last 10 years a large increase in adventure holidays, and so a lot of these expeditions can occur during people's summer holidays. But for entrepreneurs, adventurers like, for example, Mike O'Shea, when he climbing the North Pole, he has a window of about 6 weeks between March and April. Climbers for the summit of Everest have a similar window, and I think that's about April. But if you're trekking in the Himalayas, the window for trekking is October. Of course, October this year, they had massive avalanches over there, so you can never really guarantee that the weather's going to stand up for you. Expeditions really depends on where you go. An expedition to Kilimanjaro on the particular route that we travel on takes 12 days. That's because we take a route which is a long route, but it allows for plenty of acclimatization, and therefore we regard it as one of the safest routes. Other expeditions to the North Pole, South Pole, well, you're really looking at 3 or 4 months. But if you do go on expedition, you need to really question what your motivation is and what skills you bring to the team. The type of expeditions we see nowadays, the first example of an institutional expedition would be the Royal Geographical Society in London would have sponsored all the Everest expeditions in the early part of the last century. They still sponsor expeditions. Commercial expeditions are the adventure holiday groups I talked about. Charitable expeditions, well, we raise money, all our climbers would raise money for an Irish charity and an African charity. Private expeditions, you could include people who are maybe attempting the 7 summits, and so they have their own goal and they would fund that. And then you obviously have various films and TV projects. In a group going on expedition, it has its own human dynamics. There's often no running water when you're away in an expedition, so that's something you have to factor in and think about. Motivation is something you really need to sit down and consider. What is your motivation for taking this challenge? Everybody has their own Everest, but at the end of the day, when you achieve what you want to achieve, there's a great feel-good factor out of that. In 2010, this gentleman was our team leader when we climbed Kilimanjaro for the first time. And when we came down after the successful climb, he asked me would I get involved in health and safety on taking more climbers up the mountain. I was delighted. I had enjoyed the trip the first time. But Ian said to me, "Here's the thing, Padraig, I want to take teenagers up." And I looked at him and said, "Why would you want to do that, Ian?" And he said, "You know, teenagers," he said, "they have no concept of the potential they have within them." And he was a lecturer in motivation. He focused on his conversation with you and not what he'd previously done. And he was also a lecturer in a number of schools in the city, Belvedere, King's Hospital, schools in Crumlin and Drimnagh, to name a few. But he had, in the previous 10 years, set his own goals. In 2004, he broke the world record on the 5 peaks. 2007, he broke the world record by 32 days on the 7 summits. And he was always pushing himself to his next challenge. But Ian wasn't a mountaineer. He never said he was. He never pretended to be. But what he was, as quoted by Gráinne Willis, was he was an athlete who trained and then took to the mountains. He was extremely positive. He would challenge you to go out there, get up and do something. And I think the teenagers loved him. So he started looking at Kilimanjaro as a challenge. And it wasn't just a challenge on the mountain. He would talk to the teenagers and basically say to them, we're going to train you, we're going to look at your reasons for motivation, why you want to do this, I want you to write a letter. The whole school would write him a letter, and then he would select 10 to 20 children from that school, and then he would give them a training program. In 2012, having had a successful number of groups go up in 2011, once again, he said to me, Padraig, here's the thing. We're going to break a world record. We're going to take up a large group. The previous group size had been 60. He said, but I think we can safely bring up 120. So I then had to go looking for doctors like Emmanuel. So for the 120 climbers, we split them up into 6 groups of 20. Each group of 20 had 2 doctors. So all information that regarding the climb on the 6 days as we slowly climbed up the mountain was passed through these 2 doctors. So logistically, it actually worked out very, very well. These two doctors will coordinate with myself, who was the lead clinical doctor of the team, and around where I was, I had my own pharmacy, oxygen, defibrillator, all the medical kit, stretcher, you name it, we had it. I'd say we had about 75, 80 transition year students. There were not many parents, and there were not many teachers with them. So that was a challenge. And for each climber, we would have had 3 porters and 1 guide. Sorry, not 3 porters. For every climber, we would have had 3 to 4 guides. So if there were 120, you can imagine the size of the group traveling around the mountain. So after that successful climb, Ian then set up a group called Kilimanjaro Achievers. And the Achievers was essentially in recognition of all the teenagers that had achieved this summit on Kilimanjaro. I have to tell you that the excitement every time we came off the summit was palpable and infectious. I have to say that having climbed it each time, people say, why do you do it? But you actually get sucked into the whole experience. And it's not just about being on the mountain, it's being down on the mountain with the porters, guides, their family, their children. We support now an orphanage. As you know or may not know, Ian was unfortunately killed by lightning about 2 years ago. We have built an orphanage over there, the Ian McKeever Orphanage, and that orphanage also supports 5 schools. So when we raise funds for the climbs to Kilimanjaro, we raise money for an Irish charity, but we also raise money for that African charity. So we have tried to keep Kilimanjaro Achievers going. We take about 2 or 3 groups a year. We target those individuals that have an extra special reason to want to achieve this. Shane, who we will meet later, was one of those people. This year we hope to take up a group of 20 children, teenagers, who in the previous 2 years have undergone scoliosis surgery. And some people look at us and say, well, is that not risky? But we're not risk takers because we can't really afford to be. So we ensure that all our climbers are well trained. So for these scoliosis patients, they will undergo functional assessment, they will undergo fitness testing, and they will be trained on 6 or 7 of the Irish summits. So by the time they head out for Africa, they're ready for it. And more importantly, they want to climb the mountain. So that's just some of the detail that I've talked about, some of the details that actually Emmanuel will talk about after. These are some of the mountains we will climb, and I'm sure some of you will have climbed them in the audience as well, some of our fantastic Irish mountains. Our training program will start with some cardiovascular work, but we'll also need to do hill work. We take bloods to make sure our hemoglobin levels are at their optimal, to ensure we get good oxygen delivery to the tissues when we're at altitude. And obviously, nutrition is very important. On the mountain, then, once we're in Africa, we can't expect, this was something Ian I said, you won't expect teenagers to come and talk to us. They won't want to bother us, so we have to make them come. So every morning, every evening before the meal, we would measure their heart rate, sat rate, and other important parameters, and we'd ask them questions about 5 symptoms. And so the whole point of that, and this is Ian doing that one night in the tent, the whole point of this is, and these are some of the questions that we would ask, is that we could monitor the climbers twice a day, and therefore pick up anybody who was struggling and maybe develop any signs of acute mountain sickness. We found that the properly prepared climbers do develop minor symptoms of mountain sickness, but because of the route that we tend to go, the further up the route we go, they acclimatize much better, and so the symptoms get less and less and less. As I said, the effect on the kids coming down is fantastic. Once they start to come down the mountain, they really don't need us anymore, because as they descend, any risks are suddenly no longer important. There are lots of testimonies that we have on our website, and what some of these kids have said in the past is inspiring. But what we hope we have given them is a template for any challenge that they may subsequently do. And when you think most of them are in transition year, their next challenge is their leaving cert. But there are no guarantees, of course. So this brings me on really to talk about Shane. This is Shane in the middle. And I'm going to ask Shane a few questions in a couple of minutes, but just very quickly, just to put everything in perspective. If I wanted to climb Kilimanjaro, I probably would need maybe 4,000 calories a day to get the energy to climb at altitude. But because of Shane's having cystic fibrosis, for him to see 4,000 calories, he needs to take in 6 or 7. So nutrition is a massive challenge at altitude. Shane wanted to go to Kilimanjaro when Ian spoke to the school and sent in a letter. Ian saw his letter and said, "Shane, we think you should come with us." And then, of course, he wasn't able to follow that up, but Shane climbed with us in 2013, and for whatever reason, struggled at about 3,500, 4,000 meters, and it was felt that he was not well enough to carry on, and that we should take him down. I was supposed to look after him that trip, but unfortunately my wife was there and she looked after him on the mountain. And so when Shane came up to me about a few weeks after that and said, "I want to go again," my wife said to me, "He's all yours." What a brave decision. I mean, here was somebody that had already been challenged, and you could say physically challenged to achieve this. I only know of one other cystic fibrosis person who's reached the top of Kilimanjaro, and she climbed with us 2 years ago. But the bravery to say when he came back is, "I'm going to do that again," was remarkable. We basically agreed, Shane and myself, that if he were to climb again, that We needed to do something differently. We needed to train differently. With Shane there, we have Jack and Neil, 2 pals from college, and he trained with them, which I think made his training easier. We started off with the training program that he, with his physical instructor, developed. But halfway through, I said to him we were going to exercise test him and quantify if there had been any improvement to his training. We did that. Shane had done quite well. We modified it. We added more endurance training, and we just took off for the mountain. And I think the only problems that Shane had on the mountain was when he passed the point where he had was not able to get past the time before. It was like a great load lifting off himself. And so he carried on, and he was fantastic. But I think the 2 lads played a big part too. We were really only there in the background. If ever we wanted to know whether Shane was struggling, we'd look over him. If he was laughing with his pals, then Shane was okay. So I think I'm done, as it were. It's time for me to hand over to Manuel, because he's got better pictures. He'll be able to tell you something different. And then we're going to have 2 or 3 minutes. I'm just going to ask Shane some questions about what he thought about his experience. Okay, thank you. Dr. Manuel Hennessy, ladies.
Hello. Good evening. So so thanks very much for that. And I suppose it was last July when Padraig told me in the cardiac theatre, here's the thing, and he knew about my interest in maybe going and doing a climb like this. I kind of didn't know what I was getting myself into, but I'm very glad that he got me into it. So here's a picture of myself and Padraig, and we're at the summit, or we're just reaching the summit of the true summit of Uhuru here, but the summit of Kilimanjaro is a rim crater, the Kibo Crater. So I'll just give you a little background to the mountain. It's the highest mountain in Africa. It's the tallest freestanding mountain in the world. It's there's 3 volcanoes on the mountain. There's the Sheeran volcano in the west, which we used in our route. There's the Mawenzee volcano, and then there's the Kibo volcano, which is the crater. The Kibo Crater is dormant. It last erupted about 250,000 years ago. Here's just a picture of where Tanzania is. So that's Zanzibar, where Stanley made his journey across. Tanzania was colonized by the Germans, so it was German East Africa, and Kenya was the British. Now, Kilimanjaro, there's obviously lots of artificial lines drawn in the sand in Africa, and the border here is completely artificial because the people there, they're the same tribe on both sides. The deal that came to between the British and the Germans, Kilimanjaro went to Tanzania and Mombasa went to the British. Now they speak Swahili and English in Tanzania. This is just a picture. I thought it was quite an informative picture of how climate change is affecting the mountain, and you can see there's a large ice and glaciated cap on the mountain in 1912. That's just been diminishing, and they predict that in 20 years' time the glaciers and the ice will have gone. We decided on the Lamoshi route just because, as Padraig alluded to, the safety profile is better. We don't want to take any risks with the children that we're bringing up, and that's kind of part of the ethos. But also, it's a nicer route to go up. You start to meander up, and the chances of getting headache and other symptoms of acute mountain sickness are a lot less. The total distance that you end up walking is about 70 kilometres, and that's spread out over 7 to 8 days. So it's 8 days from the top to the bottom. This is just a map of what happens. So every year there's about 30,000 people that go up Kilimanjaro, which is a huge number, and that's just been growing year on year. We've used, in conjunction with a couple of African guys, set up a guiding company called Everlasting, and we use those for a number of reasons, but the most important reason is because they're wholly owned African operation, and any profits that are made, they keep those at the mountain, which is very important for sustainable tourism. The Machame route is probably the most popular route. It's done in a day less than the Lamoshi route, and that shares some of the higher camps. And then also the Lamoshi route is a lot quieter, so you don't get that volume of climbers and trekkers up it. This is the first day. So when you're going up Kilimanjaro, there's lots of different climates that you experience. You go through savanna, scrubland at the bottom, then you're kind of into this kind of almost rainforesty type climate, and it rained a lot that first day. But these are the porters and the guides. So in Tanzania, the money raised from the parks is about 50 million, which is a huge amount in Tanzania. And by law, the government mandates that there has to be a certain porter to guide climber ratio, just to provide employment for the local people. And what they're doing is this: they fly up ahead of all the trekkers, and when we arrive at camp, they've already set up the camp. So it's kind of climbing luxury, if you like to say that. This is a picture of the porters and guides with Everlasting, and I suppose what it demonstrates is Everlasting, the ethics behind the company. All these guys are well fed and they're provided with warm clothes, which is quite important. Some of the other South African American guiding companies, they don't treat the porters as well as these guys are treated. And every morning we're introduced to dancing. I thought it was a bit weird at the start because everyone, these guys are chanting and dancing, and by the second morning everybody was up and at it. It was a great way to start the day. So from day 2 then we go from the Kibo Camp up to Shira 1, and it's not a great elevation gain. It's only less. It was about 800 meters, but it's you're now starting to get up to an altitude that you may 3,600 meters is probably the top of a ski lift, an alpine ski lift, in a resort. We go onto the Shira Plateau, which is, I would say, the Shira Plateau was formed by the Shira volcano, and this is all from lava flow, and it's very, very flat. That's Kilimanjaro in the background. So then from Shira 1 we go to Shira 2, and this day we're just traversing across this big plateau, but all the time we're acclimatizing ourselves. Our bodies are acclimatizing to the lower pressure of oxygen, and that's that turns out to be quite important. I have an important slide to show you that demonstrates that. That's the sunrise. That's Mount Meru in the background. It's about 120 kilometers away from where we are. It looks like it's just there, but it's quite far away. And this is just the point where it starts to get freezing cold. Once the sun goes down, the temperature just plummets, and we're in our sleeping bags before long, with an Algene of hot water. But so on day 4, then we leave Shira 2 camp and we're heading towards the Bronco Camp. Now this is an important day for us because we're obviously going to the Bronco Camp, but to get there we have to go up to come down. So we go to this place called the Lava Tower, which is just under the under the face of the summit of Kilimanjaro. And to do that, then once we get to the Lava Tower, we come down, and this day is crucial for acclimatization. A lot of people experience headaches on this day. When we got to 4,500 meters, we stopped and had lunch, and there was quite a few sore heads. But once we got down to Bronco Camp, they kind of started to ease off, and it was much more pleasant for everyone. That's just a picture of Bronco Camp. Not a great picture of Kilimanjaro, but it's a nice camp. And again, this is the Bronco Valley, and the natural fauna and flora is very well adapted. So each one of these stalks here takes about 7 years to grow, and at the bottom you have this thing, it's almost like cotton wool, where just these trees are insulated. Again, they've adapted over many millions of years, but it's they're quite pretty, I thought. And here's a picture of the summit from the bottom of Bronco Camp, and it looks quite an imposing summit. Now, unfortunately, we didn't get to go up this way, but we went around the shoulder. And this is what we went up. So it's called the Bronco Wall. And the Bronco Wall I suppose it'd be no steeper than what the Devil's Ladder is on Carntool. It's kind of more scrambled than anything. Looks like it's, deadly there, but it's actually not that bad. And at the top then, myself and Padraig, we monitored all the climbers. So we brought up 15 climbers last October. We monitored everybody twice a day. We annoyed them. We took their blood pressures. This is at the top of the Bronco Wall here. We monitored their saturations, and we did the Lake Louise score. We did it for, one, to keep an eye on the climbers that we had, and two, hopefully we'll get to write it up in some sort of study at some point. So from the Kranga Valley then, from Bronco we go to day 6, we get to the Kranga Valley. There we make camp, and the next day we're going to go to base camp. Now once we go to base camp, we're at the same altitude that we were at the Lava Tower. We're at 4,500 meters, except now, because people have had the extra days acclimatization, the symptoms of acute mountain sickness are just dramatically lower, and I have a good slide to demonstrate that. These are some of the glaciers that you'll see on the way up. They look tiny from the bottom. They're quite impressive. And these guys were ice climbing up the top here. It was I thought they were mad now because the ice is melting. But anyway, this is a picture of our group, and that's at the memorial where Ian passed away. And we had a nice time of reflecting, and it was a nice day. Ian was a friend of all the African tour guides, and a lot of them would hold him in really high regard, and he brought a lot of work and tourism and friendship to these guys over many years, and they really respected him. So here we are on summit day. We get to from Brafu camp, which is the base camp. We start off climbing at about 12 o'clock at night. We won't get back, and we won't stop walking until 6 o'clock the next day. So it's a very long day, 16, 18 hours, but very enjoyable. We start off in the camp and with head torches and head down. We're kind of making our way up, and we get to quite near the summit ridge, near sunrise. So it's beautiful sunrise, and these are some of the guys here. They're kind of excited. And so from there then they get to Uhuru Peak, which is the highest point in Africa. And for the next, then they go from Stella Point, which is the kind of the rim of the crater, to Uhuru Peak, which it looks like it's a very short distance away, but at that altitude you're very tired, and even small steps take quite a bit of effort. And that's a picture again. And these are some of the guys at the summit. So we picked up a few strays along the way, and but they're friendly strays, so it's all right. That's a picture of the crater, the Kibo Crater, and as I was these glaciers are all but melting, but it's quite an impressive crater just to stand there. The diameter across is 1.3 kilometers, so it's quite a long walk to walk around it. But I believe there was a bunch of South African cricketers who had a game of cricket up here not so long ago. They broke the world record too, Park. So Swahili for slowly, and this is Poli Poli, and it's not because of the poles. And but that was their motto, and they kind of used that all the time. And that's kind of the way you gotta climb any big mountain really. Slowly, slowly. If you go up too quickly, you'll get sick and you'll get a headache and you won't enjoy yourself. This is a picture of Shane here coming down, and that's Padraig and some of the lads, and that's a picture of Padraig and Shane with some of the lads at Stella Point. And I think, Padraig, you're wearing a t-shirt that says
no water tax here.
the highest water charged protest, which is another world record. So this is a picture when we get down of Kilimanjaro on that day that we summited. So I was saying, so I've got to run through here, but safety on the mountain is paramount. We don't take any chances that we think are avoidable. This is important, and Ian gave these guys water treatment filtration systems that are still going. They're still using them. They're very well. They're metal filters, and that's I mean, to get good clean water at altitude is a godsend, really. We were just talking about the monitoring. We monitor the respiratory rate, heart rate, blood pressure, and the O2 saturations. Padraig touched on a little bit about the Lake Louise score. Again, we kind of question the children or teenagers every day just about these symptoms and making sure that they're getting well hydrated, and if they have a slight headache that they take paracetamol, and keep an eye on them. So I was saying just about the elevation distances, and this is just a representation of how you go that day. You go to the Lava Tower, which is, you're sitting on top of the Matterhorn at that point. And here is some research that was done 2 years ago, and what it demonstrates is that as you go up, the percentages here are the percentages of headaches. So on that day afterwards, 1 in 5 people had the headache. But once people got to the base camp, which is at the same elevation, 7 in 20 had a headache, whether that be mild, moderate, or severe. And I suppose it's kind of a graphical representation really of how people start to acclimatise, and how kind of climbing high but sleeping low is very important. So that's just to summarise that climbing at extreme altitude needs caution. We didn't take any risks that we thought were avoidable, and the Lomotion route was chosen because it was the safest trip, and I had a great time. Thanks very much, Padraig.
Thank you, Manuel. He was very, very helpful. He gave me opportunity to rest up there, and I have to say we don't get that much in the hospital, so that was very much appreciated. I'm actually going to now ask Shane to come up and talk and sort of Shane likes to keep a quiet and a low profile, but when you do what he did, when you achieved what he did, I'm afraid this is the sort of attention you're going to get. About 4 weeks ago, he received an award from the Kildare County Council, a special award, and there's not many of them around, so all this is very, very well deserved. Now, Shane, this is a microphone, and I'm going to ask you a few questions, and we want to know what makes your clock tick. So, what I want to know is, first of all, Ian McKeever came to the school and talked to you. Why did you come away and decide, I want to climb Kilimanjaro?
Well, basically, Ian just motivated me to want to climb it. I don't really know what it was, it's just something about it made me want to do it.
Everybody in the school felt the same way, did they?
Pretty much. There's about 100 plus students wanted to do it after the talk.
And so the 100 students wrote letters. Can you remember what you wrote in your letter?
No, it was my sister wrote it.
There you go. So I know your sister was disappointed when you didn't make the mountain the first time, but can you remember anything about that first time you climbed?
It was horrible.
Yeah, okay. So we took you down, and what was it that you decided you want to climb again?
I'm a sore loser, I guess.
Okay.
And
But you had a horrible time the first time. What was to say that you wouldn't have a horrible time the second time?
I didn't get to the top the first time, so I wanted to do it. Get to the top.
Even though you knew it was very, very difficult and hard and tough?
Yeah, well, I knew I hadn't done enough training the first time.
Okay.
I didn't prepare well enough.
So what was different second time?
Did a lot more preparation,
Okay.
a lot more training.
And of course, your two pals, Jack and Neil, were very, very key to that, I think. It's much easier to go out training when you have people to go out training with and you're not going to let them down. Do you think the exercise testing you had, did that help you?
A little bit, kind of pointed us in the right direction, I think.
Did it give you a little bit of confidence that you were doing the right thing?
Yeah, I guess so.
So, what was the difference when you climbed the second time, do you think?
Not really sure. What do you mean?
So, you know, okay, it's probably a bit of a sort of concealed question. The second time you climbed, and you seemed to find it a lot easier than the first time. You had more preparation, you were fitter. But were there any other things that stood out?
I guess I had friends there with me the second time.
I actually thought that the two lads were fantastic, and I think you all helped motivate each other. You trained together. Everybody in the group, including your two friends, everybody was motivated to help Shane Dunphy get to the top of the mountain. Now you have your leaving cert coming up, do you?
Yeah.
Okay, well, we won't say anything about that. The next question, and I'm a little bit nervous about what you might say, what are you going to do next?
Not really sure yet.
Okay, well, maybe that's... Ladies and gentlemen, Shane Dunphy. Now, Shane doesn't know this, but we are so proud of him that we want to make him an ambassador for Kilimanjaro Achievers. So I am going to ask our chairman, Gordon, to stand up and make this presentation to him. Well, my lecture is really talking about expedition medicine, and the whole purpose of expedition medicine is to make sure you're organized and to minimize risk. Hundreds of years ago, going on an expedition was dangerous. Nowadays, with adventure medicine, all these adventure trips, a lot of doctors are asked to go and help out on the trips and help the leaders. And so all the aspects of being on an expedition is about minimizing injury, minimizing infection and trauma.
Well, I found Dr. Sheeran very inspiring. He sort of motivated everyone in the lecture hall. He said a few things about positive energy and motivation, and I can relate to that. I feel like it's very important to attract positive things to yourself and just be a positive individual.
All the speakers tonight were excellent, and I found it really, really interesting and engaging.